everybody, Dan here again with Kayla. Today we're talking about pain in the front of your hip that maybe might go into your groin, that kind of pain. So we're going to start off today. I wanted to show you 3 simple exercises to help if that is painful with activity in the front of your hip. So the first one's a little bit tricky. I'm going to have Kayla come on up on her hands and knees. We've got a heavy resistance band for this, and this is a trick we use in the office. So I'm going to apply a little bit of tension to the band, and Kayla's going to push back down and then come up forward. And as she pushes forward, she's feeling that pull her hip backward toward me. So for this exercise, you could do maybe 3 sets of 15. And what this is going to do is help decrease the pain in the front of your hip as you start to bend your hip up into flexion. So if you don't have a band at home, I'll just drop that down, stay right up there. Sometimes another simple way to do this is I'll have someone just push all the way down into like a child's pose, let your chest straight down too. So what that does, I've got her with her knees out and her toes together, and that creates a little bit more space for the hip joint to keep that feeling good. And then she can rock back up onto her hands and kind of work that back and forth. A lot of times this will start really painful, and as you work into it, it'll actually ease up and you'll notice that you get that range of motion back. The key is just not to do too much too fast as you're doing this exercise. Come on your backside for me, Kayla. The next thing I'm going to have Kayla do, our third kind of mobility stretch here. I'm going to Kayla cross one foot, kind of like a figure 4 on her knee. She's going to go ahead with her hand and give her knee a push downward, and then kind of let off, and just work that back and forth. And I usually have patients, again, for all of these, maybe 2 or 3 sets of about 15 repetitions. And what you're looking for is for the range of motion to increase and the pain to decrease as you're going. If that's not happening, then give us a call. We'll help you out as you work into that. The next thing I want to do is review a couple of really good strength exercises here. So again, the last video we had really showed some foundational strength exercises for your hips. This is a great next step. So Kayla's going to come on up and grab, we just grabbed some weights here. She's going to face that direction, just demonstrate a back squat for us. She's going to sink down nice and deep into her squat and come all the way up. Maybe this looks a little bit scary to go that low into a squat for you. Usually the modification we'll do for people is we'll put a chair underneath their backside, so when they go down, they have a stopping point and they're not afraid of working into that squat. The next thing Kayla's going to demonstrate is a deadlift or a hip hinge pattern. Again, she's going to reach down into that and come on back up. Any weight will do. Sometimes we'll have people hold milk jugs for this if they don't have weights at home, but Kayla's using a kettlebell. For all of these strength exercises, same thing. I would go for 2 to 3 sets of 15 repetitions, and that seems to be perfect. Thanks a lot, Kayla. The last thing I'm going to show is just a single leg balance exercise. So all of the muscles that wrap around your hip really provide a lot of the stability in your balance or for your balance. So Kayla's going to put all of her weight on one side, and then she's going to just do a little tap side to side with that leg. As she does that, she's going to build a lot of fatigue in her quad muscle and her glute muscle on the right side, and her left leg is just kind of shaking things up on the right side for her. Perfect, that's great. I would say for that exercise, you could do a couple sets for maybe a minute, where you're really trying to build a lot of time under tension for your leg. So that wraps it up for today, for kind of some exercises to take care of pain in the front of your hip or wrapping around to the outside of your hip. I hope you guys have a great day. Thanks.